Hello everyone, I'm Roshni. Today we'll be discussing about how and when we have to take the tablets during Ramadan time. So sir, my question is, many of them have the question when they come for diet counseling, they have the questions like when they have to take the medications like diabetes medications or anything, it should be taken in the regular timings or they have to make any changes. So can you put light on that?
During, if you're already on medications for diabetes and if you want to basically do Rosa, in that case you should understand whether the medications that you're taking can cause low sugar or not. So typically insulin does not have ceiling effect. So if you take insulin and if you do not take food, you can have low sugar. And there are certain types of tablets which increase the insulin production. These oral medications also can cause hypoglycemia. Things like glimepiride, gliclazide, repaglinate. These are the usual medications which are given and which can increase the insulin production. So these medications also can cause hypoglycemia. So the understanding is that suppose if your suhoor contains basically larger amount of carbs in the morning, you can take the medications before suhoor also. But usually for most of patients, like how it works out is the morning meal tends to be like very light, and the larger part of carbs are taken during iftar. That way, these medications which can cause hypoglycemia or insulin, it's better to be taken before dinner. And if you are taking short-acting insulin or the repaglinate, which is a short-acting medication which increases the insulin production, it should not be taken during the period of fasting. That is during the period of Rosa, from like morning 5 o'clock or 6 o'clock, from sunrise to sunset.
Sir, I have one more question. If patients they have adrenal insufficiency and if they are on steroids, can they do Ramadan fasting?
Yeah. So those who are having adrenal insufficiency, like say Edison's disease, or for those who have taken steroid, high dose of steroids in the past, and now their production of steroids is low, that's called a steroid withdrawal syndrome, or it's something called as congenital adrenal hypertension. These individuals will be on steroid replacement, and it is typically given distributed throughout the day with a tablet called as Hyzon. So for those individuals who are having, observing fasting during Ramadan, so we can divide normally it's given as thrice a day. We can divide the doses as morning and in the evening. So it's better not to go beyond 6 o'clock or 7 o'clock because it is unphysiological. That's one thing. Or during the period of fasting, instead of Hyzon, we can switch over to a different form of steroid called as prednisolone. Prednisolone is a one-sided dosage that can be taken just around the time of suhoor. So we can do, we can choose either of these options, and the fasting can be safely observed during the month of Ramadan. Thank you.